discharge which causes a discharge per vaginum along with a lot of pruritus. So answer has to be kit number 1, that is grey kit beta. We know at the Suraksha Clinic, syndromic management for the STI and like syndromic management for the sexually transmitted infection is given beta under the National AIDS Control Program. Kit number 1, which is there definitely, is going to be the gray color kit beta, and it is generally used for all the types of discharges. Okay, usually like urethral discharge beta, vaginal discharge due to what? Due to cervicitis basically beta, or a painful scrotal swelling. So urethral discharge, cervical discharge, or painful scrotal swelling beta. In these conditions, definitely we can use the kit number 1, that is gray kit, which contains a drug known as azithromycin, and second is cefixime beta. Next is kit number 2, bache, that is your green color kit. Kit number 2 or green color kit is generally used for vaginal discharge beta, that is vaginitis. Vaginal discharge or vaginitis, that is bacterial vaginosis, trichomoniasis, or candidiasis beta. For them, we have the drug known as secnidazole and fluconazole beta. Next, kit number 3, 4, and 5. Which phenomena? Reynolds phenomena beta. That is kit number 3 is white in color, kit number 4 is blue in color, and kit number 5 is red in color. हमें पता है kit number 3 and kit number 4, both of them are used for genital ulcer diseases beta, which are going to be herpetic or non-herpetic. Kit number 3 and kit number 4, that is white and blue, both of them are used for genital ulcer disease which are non-herpetic in nature beta. But the only difference is kit number 3 or the white kit contains benzathine penicillin, but the kit number 4 or the blue kit does not contain any kind of penicillin. So kit number 4 blue kit is mainly used for penicillin allergic patients beta, that is important. Kit number 5 is going to be used for genital ulcer disease again, but which kind of genital ulcer? Herpetic ulcer beta. So kit number 5 is for the herpetic genital ulcer, and the drug of choice will be acyclovir. Next is kit number 6, that is your yellow kit beta. Kit number 6 or yellow kit is mainly used for lower abdominal pain or a case of PID, that is pelvic inflammatory disease beta. Here the drugs that will be present will be cefixime, metronidazole, and doxycycline. Cefixime, metronidazole, and doxycycline will be present for PID beta. Kit number 7 is going to be the black kit beta. So kit number 7 is for black, is the black kit. It is generally used for inguinal buboes. So inguinal buboes are usually seen in a condition that is known as LGV, that is lymphogranuloma venerum beta. For that we use the kit number 7, that is black kit, and it contains the drug of choice known as doxycycline beta. And last, the recent addition has been kit number 8, that is brown color kit. Kit number 8 or brown kit basically is for which discharge? Anorectal discharge. For anorectal discharge, we have the kit number 8, that is the brown kit beta, which contains cefixime and doxycycline beta. That is important to be remembered. Hopefully clear. तो इस कंडीशन में बेटा उन्होंने बोला था सर्वाइकल इरोजन, सो इट वाज अ केस ऑफ सर्विसाइटिस. भले ही वो डिस्चार्ज पर वजाइनम था, तो इट वाज एक्चुअली अ cervical discharge which was coming out from the vagina beta. Clear? Question number 133. Students of a boarding school basically beta have been eating from the same canteen. They have been eating bache from the same canteen definitely. One student develops, okay, out of all of them, one student develops an abdominal pain beta along with other features like jaundice and fever. Soon, other students also presented with similar symptoms beta. Soon, other students also had similar symptoms. The hostel medical officer will investigate beta for which among the following parameters bache to establish the diagnosis of the patient. Answer has to be option A beta, that is IgM for hepatitis A. Reason, they have said the people have been eating from the same canteen. Matlab they have been talking about which kind of route of transmission? Feco-oral route of transmission beta. I hope all of you are quite aware that the hepatitis which transmit via the feco-oral route will be hepatitis A as well as hepatitis E beta. हमें पता है which is the most common type of hepatitis in adults. Most common type of hepatitis in adults beta, it is going to be hepatitis E, and most common type of hepatitis in children. Hepatitis A is the most common type of hepatitis in children beta. That is important to be remembered. तो याद रखना definitely यहाँ पे one person has developed the problem, so obviously beta there was some problem in the food itself, and therefore immediately the other students also suffering from the same symptoms. So here it is a case of acute hepatitis A, and therefore we have to check for the IgM antibody beta against hepatitis A. HDV RNA, we know it is going to be for hepatitis D infection when we suspect co-infection or super-infection with hepatitis B. IgM for hepatitis B, which is there beta, it does not spread via the fecal-oral route definitely. It spreads via the parenteral route, either the sexual route or the blood route beta. Hepatitis E, IgG antibody beta. Hepatitis E could be a possibility, but IgG antibody are not going to check because it is a case of acute hepatitis E beta where we check for the IgM antibody. That is important to be remembered. अब अगर हम बात करते हैं बेटा फर्स्ट ऑफ ऑल अबाउट हेपेटाइटिस बी सीरोलॉजी के बारे में वी नो द फर्स्ट एंटीजन टू अपीयर इन केसेस ऑफ हेपेटाइटिस बी infection will be HBs AG. The first antibody to appear is going to be anti-HBC antibody beta, and the last antibody to appear is going to be anti-HBs antibody which है. If they ask you that the patient is having an acute infection of hepatitis B, हमें पता है whenever there will be an infection of hepatitis B, HBs antigen should always be present. As it is an acute infection, which variety of anti-HBC antibody should be present? We know the IgM variety of the anti-HBC antibody should be there, beta. And as infection is going on, we know the anti-HBs antibody, which is a marker of recovery, that will not be present. Next is window period. Window period की अगर मैं बात करूं बेटा, तो we know definitely window period में only one antibody is present, and that is IgM anti-HBC antibody. Window period में we know window period is acute ना, तो window period में it is only the IgM anti-HBC antibody which will be present. Next important is about chronic infection. तो chronic infection में बेटा please remember again as it is an infection we know that there should be presence of the HBs antigen beta. Apart from that, which antibody should be present? This time it should be the IgG anti-HBC antibody as it is a chronic infection बच्चे. Next, if they ask you that it is a case of a remote infection which has been cleared बेटा, तो remote infection बोल सकते हो या फिर तुम recovery बोल सकते हो. We know if recovery is there beta, obviously infection is not present, so HBs antigen is going to be absent. Now antibodies will be present during recovery. One is going to be the which type of anti-HBC antibody? IgG subtype of anti-HBC antibody because the recovery is going to be chronic in hepatitis B beta. And second, there will be presence of the anti-HBs antibody, which is a marker of recovery. Bachche. Clear? Next important is immunization. If the patient has been immunized beta against hepatitis B, so immunization के बाद only one antibody will be present in the patient's body, and that is anti-HBs antibody. Only anti-HBs antibody is present after immunization or vaccination beta. Next important is the inactive chronic carrier. So inactive chronic carrier में बेटा definitely the patient will have which kind of antibody? Inactive chronic carrier अगर है patient, so there will be a IgG anti-HBC antibody बेटा. Window period अगर है तो IgM anti-HBC antibody, nothing else. अगर inactive chronic carrier है तो IgG anti-HBC antibody, nothing else. Clear? So that is important to be remembered. Next is question number 134 beta. Here we are having a 22-year-old lower socioeconomic status female beta who is a worker, and she has presented to us within 8 hours of sexual assault beta on 13th day of her menstrual cycle. And she has basically asked us beta for an emergency contraception or an interception. What will be your advice to her? We know emergency contraception तब भी देना, that is also called as an interception. The drug of choice for emergency contraception is always option A, levonorgestrel, 1.5 milligram single dose she can take, or another option is basically 0.75, 2 doses she can take beta with a gap of how many hours? 12 hours beta. So we know definitely that these levonorgestrel pills are nothing else but your I pill or unwanted 72. They are definitely the levonorgestrel pill itself beta. 1.5 mg is the total dose, and that should be given within a span of 72 hours beta of unprotected sexual intercourse. That is important. Misoprostol 800 microgram strat, it is not used for contraception, it is used for MTP beta. That is important. 8 COCPs with a gap of 12 hours, that is 4 COCPs with a gap of 12 hours, and again 4 COCP pills beta. That can be taken basically for emergency contraception, okay, but that is not the method of choice beta. Next important, if I talk about OCPs from the first day of next cycle, no, till that time she will conceive. Okay? So that is what is important to be remembered. Other methods which are effective. The best method of emergency contraception which will be effective up to 5 days. The best method of emergency contraception effective up to 5 days beta will be IUCDs, that is intrauterine contraceptive device beta. That is important. Okay? Another method which can be effective up to 5 days will be Ulipristal beta. Ulipristal acetate is also effective up to 5 days. That is what is important to be remembered. Done with this? Okay? Chalo. If they ask you question number 135 beta, a disease was studied in the community and the total number of cases were assessed beta. Total number of cases will be called as prevalence or incidence. The total number of cases will be called as prevalence and only the new number of cases will be called as incidence. So total number of cases means prevalence beta. They are asking you, the epidemiologist who is there, he calculates the positive predictive value, that is PPV beta. Now, what will be the change in the positive predictive value in relation to the total number of cases? मतलब total number of cases या prevalence sorry prevalence के according बेटा PPV में change क्या होगा? I hope you might have seen definitely this graphs. ठीक है? There are two graphs that you can remember, बच्चे, and that is this one over here. You will identify which is a graph of positive predictive value and which one is a graph of negative predictive value beta. The first one is basically a graph of this is prevalence, for example, this is the positive predictive value. Bolo. तो मैंने ही बोल दिया. So that is the this is the graph of positive predictive value beta. Please remember दोनों में relation क्या है? Prevalence is directly proportional to positive predictive value beta. If the number of cases are going to be more, that is prevalence is going to be more, positive predictive value is also going to be more beta. That is important. Next graph जो है beta, that is this one over here. अब इसमें for example consider this is the prevalence and this is the negative predictive value. मतलब we know here what is the relation, that is prevalence is inversely proportional to the negative predictive value beta. इसका मतलब as the number of cases or the prevalence is going to increase, the negative predictive value is going to decrease beta. That is what is important to be remembered. Hopefully that's clear to all of you now. So that is important. Coming back to the question, PPV increases as cases increase. Is it true? Yes. The answer has to be option A beta. PPV remains unchanged. No. PPV decreases as cases increase. No. PPV and number of cases are not related. No, they are related. They are directly proportional to each other beta. Hopefully understood. Chalo. Question number 136, if I talk about beta, is newborn birth rate is going to be 25 per thousand population. That is the live birth rate or newborn birth rate is 25 per thousand population in a village with a total population of 5,000. The total number of pregnancies per year are going to be how much beta? They are asking you that. Sorry. If you want to calculate the total number of pregnancies beta, sorry. So first of all, हमें देखना है कि how much are the total live births beta, and we have to multiply the total live births by the total population. अब total live births कितने हैं? 25 per 1000 बेटा, मल्टीप्लाइड बाय टोटल पॉपुलेशन कितना है? 5000. मतलब अगर 1000 में 25 है टोटल तो 5000 में कितने होंगे, यही कैलकुलेट करना है ना हमें. सो डेफिनेटली यू हैव टू मल्टीप्लाई इट बेटा. जब मल्टीप्लाई करोगे ऑब्वियसली यू विल गेट 125. अब जब 125 कैलकुलेट कर लिया, आगे होता है कुछ, एंड दैट इज यू हैव टू ऐड 10% वेस्टेजेस बेटा. अबॉर्शंस भी तो होंगे, ठीक है? तो 10% वेस्टेजेस हैव टू बी कैलकुलेटेड और एडेड एज वेल बेटा. अब 125 का डेफिनेटली बेटा, 125 प्रेगनेंसीज का 10% कितना होगा? 12.5. 12.5 विल बी द वेस्टेजेस बेटा, ठीक है? एड दैट 125 इंटू 12.5 कितना होगा? 37.5 बेटा. अब जो क्लोजेस्ट क्या है इसमें? 138. 137.5 आ गया, तो दैट इज 138 pregnancy should be the answer. Answer has to be option B. Hopefully clear अभी. तो ये वाले क्वेश्चन में हमेशा मैंने देखा है बच्चे गड़बड़ करते हैं बिकॉज यू डोंट ऐड द 10% ऑफ वेस्टेजेस. तो पहले कैलकुलेट करो कितनी प्रेगनेंसीज है, उसमें और 10% का वेस्टेजेस ऐड करो एंड देन यू विल गेट द टोटल नंबर ऑफ प्रेगनेंसीज इन दैट पॉपुलेशन बेटा. Hopefully cleared all of you now. Question number 137. This we have discussed already. There is a group of 200 hypertensive patients beta. First group is having 100 patients who are following the medical advice bache. Whereas there is a second group of 100 patients again bache who are following the lifestyle advice beta. There is a comparative test that we have done for both the groups basically, which has been conducted after a span of 3 months. Which of the following is the best test for significance beta to compare the blood pressure in both the groups? How many groups are there? Two groups are there basically beta. 100 following medical advice and 100 following the lifestyle advice beta. So दो group है. क्या compare करना है तुम्हें? BP. BP is a value. हमें पता है. Whenever we need to compare a value beta, it is basically going to be a parametric test. And whenever we compare value in a two group, it is going to be option B. That is an unpaired student T test beta. अगर बीपी की वैल्यू कंपेयर कर रहे हो दैट इज पैरामेट्रिक टेस्ट एंड दो ग्रुप में कंपेयर कर रहे हो तो अनपेयर्ड स्टूडेंट टी टेस्ट. अगर एक ग्रुप में कंपेयर कर रहे होते तो पेयर्ड स्टूडेंट टी टेस्ट बेटा. ठीक है. फिशर टेस्ट बेसिकली इज नॉट यूज्ड फॉर comparisons of the values basically beta, and chi-square test is used for comparison of not the values again for the fraction beta, fraction of percentage. Question number 138, direct straightforward question. A 54-year-old female presents with amenorrhea for the last 16 months. What is the diagnosis? 54 के age में she is having amenorrhea or absence of menses for the last 16 months, more than 1 year. So she is having a menopause now. So menopause का diagnosis है. Now she is in the post-menopausal age group. They are asking you what should be the expected finding beta in this patient. बोलो. मुझे बताओ. Menopause में what will happen to the ovaries beta? In the menopause, the ovaries are going to be atrophied beta. As all the eggs will get used up, the ovaries are ultimately atrophied बच्चे. जब ovaries atrophied हो जाएंगी, amount of estrogen secreted will be more or less. So the amount of estrogen which is there beta from the ovaries is going to be very, very less. So will there be any negative feedback to the pituitary gland? No. And if there is no negative feedback to the pituitary gland is going to secrete excess amount of LH and FSH beta. So high amount of LH and FSH. So answer would be option B beta. That is increased LH and increased FSH will be seen in the menopausal age group. Repeated question है ये exam का. Do remember that. ठीक है. If estrogen and progesterone are going to decrease, even progesterone will decrease, na? So if estrogen and progesterone both are going to decrease bit after menopause, there is no negative feedback even by the estrogen or by the progesterone that will lead to increase in the levels of FSH and LH. Done. Question number 139 beta. Here we are having an elderly patient who is a known case of prostate cancer beta, who develops which kind of urine? Frothy urine beta along with hematuria. And dipstick was performed on the urine sample showing you 4 plus proteinuria beta. Which of these is the likely finding expected on the histopathology of the patient? Bolo. Very good. What is the classical diagnosis? Elderly patient having prostate cancer develops frothy urine and hematuria. So whenever there is a history of infection or a history of malignancy, and that too in an elderly patient, and then he develops glomerulonephritis causing proteinuria and hematuria, it is a diagnosis of MGN. The diagnosis of the patient is membranous nephropathy or a membranous glomerulonephritis. And due to membranous glomerulonephritis, beta, you are able to see definitely this classical spike and dome appearance. There will be subepithelial deposits, beta, and these subepithelial deposits will give you the classical option C, spike and dome appearance. Starry sky appearance on the direct immunofluorescence of kidney biopsy is seen in PSG and beta. Mesangial proliferation is a feature of. Mesangial deposits or mesangial proliferation is a feature of IgA nephropathy beta. And double counter basement membrane is a feature of MPG, and that is membranoproliferative glomerulonephritis, where there are a combination of both nephrotic as well as nephritic syndrome, which that is what is important. Hopefully cleared all of you now. याद रखना है बात. If I talk about the basic differences about nephrotic and nephritic, एक बार जल्दी से, the two types of nephrotic and there are two types of glomerulonephritis beta, that is nephrotic syndrome and nephritic syndrome. Three important features. First, दोनों conditions में as the glomerulus is damaged, the patient is going to develop protein urea. It is more in cases of nephrotic syndrome, which is more than 3.5 grams per day, whereas it is less than 3.5 grams per day in case of nephritic syndrome. Next, hematuria is a feature of nephritic syndrome beta. Okay, whereas hypertension is also a feature of nephritic, whereas hypoalbuminemia is a feature of nephrotic syndrome where there is predominant loss of predominant loss of albumin in the urine. And as there is hypoalbuminemia beta, the patient is going to develop generalized edema beta. Hopefully that's clear to all of you now. So these are the features of nephrotic and nephritic syndrome. Most common cause of nephrotic syndrome in adult patients. Most common cause of nephrotic syndrome in adult patient is FSGS, that is focal segmental glomerulosclerosis. Most common cause of nephrotic syndrome in children, MCD, that is minimal change disease. And most common cause of nephrotic syndrome in elderly patients will be MGN, that is membranous glomerulonephritis. Most common cause of nephritic syndrome in adults will be IgA nephropathy. Most common cause of nephritic syndrome in adults is IgA nephropathy. Most common cause of nephritic syndrome in children is PSGN. Most common cause of nephritic syndrome in children is going to be PSGN, that is post streptococcal glomerulonephritis. Hopefully clear to all of you now. Uh-huh. Finish is basically a variety of congenital nephrotic syndrome और congenital FSGS. तो बच्चे में जब जन्म से ही जीन म्यूटेशन होता है बेसिकली NPHS1 या NPHS2, स्पेशली NPHS1 का, तब जो टाइप ऑफ FSGS होता है बच्चे में, दैट इज कॉल्ड एज अ फिनिश वैरायटी. फिनिश मतलब फिनलैंड से आया है वो टर्म. ठीक है. If they ask you question number 140 beta, that is a 30-year-old female patient presented to the OPD beta with symptoms of what? With symptoms of burning, micturition and fever beta. Histopathology demonstrates the presence of large amounts of pus cells and a preliminary diagnosis of a UTI or urinary tract infection. Which among the following antibiotic is least likely to be effective for the treatment of UTI? Bolo. Very good. हमें पता है that nitrofurantoin is one of the first line agents beta that we can use in the treatment of UTI. Phosphomycin is also a drug used for treatment of UTI, and levofloxacin is also effective in treatment of UTI. Moxifloxacin is not very effective in the treatment of urinary tract beta. It is mainly like effective definitely for lung infection or pulmonary infections, which that is what is important to be remembered. Hopefully that's clear to all of you now. So that was important. If I talk about the antibiotics, एक बार overview देते हैं, and that is if I talk about which are going to be the 30S protein synthesis inhibitors, बोलो. हम्म. तो one is definitely okay. तो 30S protein synthesis inhibitors की अगर मैं बात करूँ तो AT is the mnemonic. AT में A for aminoglycosides, all the drugs that end with mycin beta, streptomycin, amikacin, kanamycin, neomycin, all of them. Second is going to be tetracyclines, which that is all the doxycycline, tetracycline, dimeclocycline. Next important, if I talk about the 50S protein synthesis inhibitors, तो 50S protein synthesis inhibitors की अगर मैं बात करूँ, the drugs can be remembered by the mnemonic MLC. Sorry. Now, if I talk about M for macrolides beta, so M for macrolides definitely will be there. L for linezolid beta, L for linezolid is going to be there. Then C for chloramphenicol beta. These are going to be the 50S synthesis inhibitors definitely that you have to remember. Okay, next important if I talk about beta is the DNA gyrase inhibitors. Which are the DNA gyrase inhibitors? DNA gyrase is an enzyme which helps in DNA replication. But agar DNA gyrase enzyme is inhibited in the bacteria, DNA replication of the bacteria doesn't happen, so cell division doesn't happen. These are nothing else but the drugs known as fluoroquinolones, all your floxacins which are there beta. These drugs are going to be DNA gyrase inhibitors itself. That was a question PYQ. Mechanism पूछा था. ठीक है. DHFRase inhibitors will be dihydrofolate reductase inhibitors basically. These will be mm-hmm. Methotrexate is an anti-cancer drug. Antibiotics की बात चल रही है. Dihydrofolate reductase inhibitors are going to be drugs like sulfonamides, and second will be trimethoprim beta. So sulfonamides or drugs like trimethoprim basically they are going to be the dihydrofolate reductase inhibitors. Hopefully that's clear. Last important will be cell wall synthesis inhibitors beta. I hope all of you are quite aware that cell wall synthesis inhibitors are definitely which drugs. First group is obviously the beta lactams. Beta lactams mein we are going to have drugs like penicillins, cephalosporins, carbapenems and monobactams. These are the four groups of beta lactams basically. Next, it is a drug known as vancomycin beta. Vancomycin is also a cell wall synthesis inhibitor. Then there will be drugs like polymyxin and all. So that is what is important. Okay. So this is basically the mechanism of action of antibiotics. Major side effects याद होने चाहिए. यही मैं बोलता हूँ basically कि if you know this, things will be much easier. ठीक है. So aminoglycosides are going to be autotoxic and nephrotoxic beta. Tetracyclines, if they are given during pregnancy, they are actually known to cause damage to the cartilage and the teeth basically with the bone, teeth and cartilage will get damaged due to tetracyclines basically beta. That is important to be remembered बच्चे. ठीक है. Fluoroquinolones, if they are given during pregnancy, they are also known to cause damage to the cartilage and the bones beta. Cartilage and the bones are going to be damaged due to fluoroquinolones. That is what is important. Question number 141. A patient was receiving an anti-cancer therapy beta. He presented to you with complaints of high-grade fever along with sore throat beta. Hemogram revealed the total leukocyte count of the patient is going to be 2000 cells per cubic millimeter. Normal total leukocyte count कितना होता है? Very good. 4000 cells to 11,000 cells per cubic millimeter. यहाँ पे it is less. So the patient is actually having a leukopenia. And we know that after chemotherapy, if the patient is having leukopenia, cause क्या है? It is basically due to bone marrow suppression. I hope all of you are quite aware that majority of the anti-cancer drugs are known to cause bone marrow suppression that can lead to anemia, leukopenia, or even thrombocytopenia. Which among the following drug is likely to be effective in the patient's treatment? Bolo. आंसर हैज टू बी ऑप्शन बी दैट इज सारग्रामोस्टिम. नाम में ही है उसके ग्रैनुलोसाइट मोनोसाइट स्टिमुलेटिंग. ठीक है. तो ईदर यू कैन मार्क इट एज फिलग्रास्टिम. Filgrastim is granulocyte stimulating, which will definitely increase the levels of granulocytes like neutrophils, basophils, and eosinophils. And sargramostim is a granulocyte monocyte stimulating, which will not only increase the levels of granulocytes but also the monocytes beta. That is important. So sargramostim or filgrastim like drugs are going to help in patients of chemotherapy induced leukopenia. अगर chemotherapy induced thrombocytopenia होता then I would have gone for oprelvecin beta. Oprelvecin, which is interleukin 11 activator beta, it is generally used in patients who are having decreased platelet count or a chemotherapy induced thrombocytopenia beta. Romiplastrum is also used for thrombocytopenia itself, and darbepoetin would have been used beta if the patient had a chemotherapy induced anemia. So chemotherapy induced anemia mein the patient would be given darbepoetin bache. That is important. Understood? Hopefully clear. Next important, if I talk about question 142, here they say a 50-year-old male presents to you beta with acute chest pain. A preliminary diagnosis of acute angina was made and nitroglycerin was given sublingually to the patient beta. The pain was relented within 5 minutes. That is, the pain disappeared within 5 minutes. What is the likely mechanism of this drug? Which drug has been given? Nitroglycerin has been given. Nitroglycerin belongs to which group of drugs? Nitrates beta. I hope all of you are quite aware. Nitrates are the group of drugs which are known to release nitric oxide. Nitric oxide is the chemical agent beta which is known to activate an enzyme called as guanylate cyclase. And guanylate cyclase, once this enzyme is going to be activated, obviously it is going to convert your your ATP, sorry, GTP, your GTP beta into cyclic GMP, and the level of cyclic GMP, which is a secondary messenger, is going to increase. And as the level of cyclic GMP increases, the patient is actually going to have vasodilatation due to protein phosphorylation and all. Ultimately, there will be vasodilatation, which will improve the blood flow beta. That is what is important to be remembered. तो बताओ अभी Answer has to be option C. We know nitroglycerin is a nitrate which will release nitric oxide and therefore increase the level of a secondary messenger known as cyclic GMP. So it increases the level of cyclic GMP for causing vasodilatation. This has been a previous year question of your FMG exam. Do remember that. Okay? Chalo. Next important if I talk about beta is going to be question number 143. Which among the following drug is used as a radiosensitizer beta in the head and neck cancers? So head and neck cancers में before radiotherapy you should give a particular chemotherapy drug beta which will increase the effect of radiation basically and will have better efficacy then. And that drug is going to be option B, that is paclitaxel beta. Paclitaxel, cisplatin, these can be drugs which can be used as radio sensitizers beta. Paclitaxel is a very common drug used for head and neck cancers beta as a radio sensitizer. Repeated question of FMG exam. Please be aware. Clear? If I talk about anti-cancer drugs, mainly चीजें जो याद रखनी है बेटा, it is nothing else but the side effects of the anti-cancer drug that you have to mainly remember. अब just follow the schemo man बेटा. यहाँ पे you can see C जैसा क्या दिख रहा है बेटा? C जैसा उसके कान दिख रहे हैं और kidneys दिख रही है. So definitely the drugs like cisplatin and carboplatin are responsible for ototoxicity and nephrotoxicity. Next, V जैसा क्या दिख रहा है? V जैसे उसके हाथ और पैर दिख रहे हैं basically बेटा. So definitely vincristine like drugs are known to cause peripheral neuropathy beta. B जैसा क्या दिख रहा है? Lungs उसके. So obviously the drugs like bleomycin and busulfan are known to cause lung or pulmonary fibrosis beta. Next, T जैसा क्या दिख रहा है बेटा? उसको टी डेफिनेटली उसके दिल के अंदर है बेटा. So drugs like trastuzumab और D से क्या स्टार्ट हो रहा है? Doxorubicin. So trastuzumab or doxorubicin like drugs basically are going to be highly cardiotoxic in nature beta. That is important. Next, C stands for what? Cyclophosphamide. So cyclophosphamide is also known to cause C और Y से क्या बना है? Bladder बना है. So cyclophosphamide is actually known to cause hemorrhagic cystitis. Drug of choice to prevent hemorrhagic cystitis caused by cyclophosphamide. Mesna beta. Mesna is the drug which prevents hemorrhagic cystitis due to cyclophosphamide. Next, here you are able to see drugs like methotrexate, 5-fluorouracil, and 6-mercaptopurine. They are known to cause bone marrow suppression, that is myelosuppression, which can lead to pancytopenia, anemia, leukopenia, and thrombocytopenia. तीनों होगा. Please tell me, beta, that which anti-cancer drug once you have started, you need a regular LFT monitoring. LFT monitoring will be required for which anti-cancer drugs? Methotrexate. We know that methotrexate is highly hepatotoxic, so you will need definitely a regular LFT monitoring beta. Which antipsychotic drug, if you have started, you will need a regular CBC monitoring? अब बोल ही दिया था मैंने पूरा. Antipsychotic known as clozapine. Clozapine needs a regular CBC monitoring beta. That is important to be remembered. Antipsychotic बोला था ना मैंने. So that is what is important to be remembered beta. Clear है बात? So do remember this. Take a bleomycin, busulfan, cyclophosphamide, amiodarone, methotrexate. These are the drugs which are known to cause pulmonary fibrosis. So you may need to repeat definitely chest X-rays in this patient, beta, spirometries in this patient. That has to be remembered. Clear about echocardiography should be done after the patient has been started on drugs like doxorubicin, which is the most cardiotoxic anti-cancer drug beta, or another drug will be trastuzumab. That is important. Chalo. Next is question number 144 beta. Here a man came for a checkup basically after his father had a cerebrovascular accident or a stroke due to hypertension beta. Okay, due to hypertension related complications, sorry. What type of prevention is this? So now if I talk about primordial level of prevention is applied even before the risk factors are present beta, and this is done by the process of health education which is. Next, primary level of prevention will be done after the risk factors have appeared, when the risk factors are present beta, but the disease has not started yet. This is of two types. Either we can go for health promotion beta or we can go for specific protection which is. That is what is important in primary level of prevention. Next, secondary level of prevention will be done when the disease has already started. When the disease has started, beta, we go for secondary level of prevention, basically, beta. And That is going to be either any kind of early diagnosis beta. Early diagnosis can be done by screening test or any kind of diagnostic test beta or any kind of treatment. Next, tertiary level of prevention is done when the disease is already over or the disease is causing any complications beta. And this stage may we have to go for disability limitation बच्चे जो भी complication है वो कम से कम हो. Disability limitation we are trying to do, or we will try for a rehab. अब मुझे बताओ, definitely here we are doing what? Here we are doing definitely a checkup beta after his father had a stroke beta due to hypertension related complication. So can I say definitely the risk factor is present? Yes. तो जब risk factor present होगा तो primary हो सकता है. But problem is यहाँ पे हम कर क्या रहे हैं basically? Are we doing any health promotion? No. Are we doing any specific protection? No. We are actually trying to diagnose the disease beta. And early diagnosis के लिए it has to be nothing else but option C, that is secondary level of prevention beta. Hopefully that's clear. याद रखना. So please still remember all the types of screening usually will be included in secondary level of prevention. Secondary level of prevention में which screenings will be there? Prospective or prescriptive? Prescriptive. Very good. Only prescriptive screenings beta. Prescriptive का मतलब those screenings which are necessary for an early diagnosis. Okay. Prospective screenings will be primary level of prevention. Prospective screening का मतलब screening of the refugees or screening of the migrants beta who are coming from the international border. So definitely the disease is not present in the country. Even before the disease comes in the country beta, you are doing a screening basically. So that is not done for the purpose of early diagnosis. उनका diagnosis तुम्हें करके कोई मतलब नहीं है. तुम्हें बस उस disease को अंदर नहीं आने देना बेटा. That is the reason why we are doing a prospective screening at international borders of migrants beta. That will be an example of prospective screening, and that is the only one where there will be a which will be a primary level of prevention. Next, all the vaccines will come under primary level of prevention beta, except BCG vaccine in bladder cancer. It will be secondary because it is generally used for treatment beta. All the contraceptives will come under again primary beta, except the COCP pills in endometriosis or in cases of PCOS. Secondary, because again they are over here they are used for the purpose of treatment beta. That is important. Next, source reduction for mosquitoes. Primordial beta. Source reduction मतलब do not let the rainwater collect itself. जमा ही मत होने दो पानी, तो mosquitoes भी नहीं आएंगे. So that is what is primordial. Health education कर दो लोगों का कि पानी जमा मत होने दो. That is what is done. Clear? Promoting the use of masks for preventing COVID-19. Primary level. Which one? Health promotion. Reason, what did I say? I said promoting the use of mask. So encouraging the use of mask or promoting the use of mask will be health promotion. तुम खुद use नहीं कर रहे हो. When they say use of mask, then it will be specific protection. So encouraging the use of mask will be health promotion. Using the mask will be specific protection beta. That is important to be remembered. No issues with this. Next important, using crutches and polio. Tertiary level of prevention, both disability limitation as well as rehabilitation. Intraocular lens in cataract. Secondary beta, because intraocular lens in cataract surgery are used for treatment basically. Contact lenses in refractive errors will be tertiary, because contact lenses or spectacles do not treat the refractive error. They are just used for disability limitation beta. Clear? So that is what is important. Hopefully clear. Chalo. Mosquito repellents, mosquito nets, insecticides, all of them in primary specific protection. उसमें भी, if you are promoting the use of mosquito nets, it is health promotion. If you're using the mosquito nets, that is specific protection. Yeah. Question number 145. Which among the following is indicative of lethality of a disease? Lethality matlab killing power of the disease. Answer has to be option C, that is case fatality rate beta. Recent exam में question था शायद. केस फैटेलिटी रेट. ठीक है. अब जब केस फैटेलिटी रेट पूछा जाए, फॉर एग्जांपल एक ये दे रहा हूं तुम्हें कि टोटल पॉपुलेशन ऑफ दैट विलेज वाज अराउंड 5000 बेटा. ठीक है. द टोटल नंबर ऑफ cases basically reported for the particular disease, TB के लिए for example there were 500 over there, and now out of that definitely beta how many deaths have occurred? let's say have been 10 deaths which have like 20 deaths which have occurred beta, ठीक है, in the last 1 year. अब calculate the case fatality rate of this disease. बोलो, case fatality rate will be what? So case fatality rate का मतलब, चलो उसमें total deaths जो होते थे बेटा, total deaths were 50, ठीक है, and due to the TB basically, due to the disease definitely there were 20 deaths. और complex कर दिया उसको. अब important is the case fatality rate is definitely the number of deaths that you will take. All number of deaths or due to the disease? Only due to the disease. Upon total population or total number of cases? Only total number of cases बेटा, क्योंकि case fatality rate calculate कर रहे हो, not the total death rate. ठीक है, तो definitely that is important into 1000 because it is a rate बेटा. Number of deaths due to disease कितने हैं? 20. Total number of cases कितने बोले मैंने? 500, 500 into 1000 बेटा. ठीक है, so that is what is important to be remembered basically. It is going to be 40 होगा ना, 40 होगा ना, हाँ, मुझे डाउट करवा देते हो तुम लोग, तो दैट इज इंपॉर्टेंट बेटा, तो इट इज गोइंग टू बी 40, ठीक है, सो दैट इज व्हाट इज इंपॉर्टेंट टू बी रिमेंबर्ड. अंडरस्टूड? दिस इज हाउ यू कैलकुलेट द केस फैटेलिटी रेट बेटा, ठीक है. नो इश्यूज विद दिस, एंड आई होप ऑल ऑफ यू आर क्वाइट अवेयर अबाउट दैट. किलिंग पावर ऑफ डिसीज इज ऑल्सो नोन एज, टर्म्स पूछ रहा हूँ अभी मैं, किलिंग पावर ऑफ डिसीज इज ऑल्सो नोन एज द एंटीजेनेसिटी, पैथोजेनेसिटी और वेरुलेंस. Killing power of disease is also known as virulence of the disease beta. That is what is important to be remembered. Next important, if I talk about what is antigenicity, anybody? दो options दे रहा हूं. First is the ability to cause the disease or the ability basically to induce an immune response. So ability to induce or stimulate the immune response beta is known as antigenicity. मतलब antibody produce करवाने की जो ability होती है, that is what is antigenicity basically. What is pathogenicity? पैथोजन मतलब डिसीज कॉजिंग ऑर्गेनिज्म ना, तो पैथोजेनिसिटी मतलब ability to cause an infection or to cause a disease बेटा. तो ability to cause an infection or to cause a disease, that is known as pathogenicity. Hopefully clear है बात. तो अगर डिसीज कॉजिंग ability पूछे, आंसर इज पैथोजेनिसिटी. इम्यून रिस्पॉन्स को इंड्यूस करने वाली ability पूछे तो आंसर इज एंटीजेनिसिटी. एंड किलिंग पावर ऑफ डिसीज इज गोइंग टू बी विरुलेंस. क्लियर? केस फैटेलिटी रेट विल टेल यू अबाउट विच फैक्टर? Virulence of the disease. बराबर ना? Case fatality rate will tell you about the killing power or virulence of the disease or the lethality of the disease beta. Question number 146. In a hospital, definitely systemic observation and recording of the doctor spending time with patients care and time without patients care basically is calculated for future management purposes. The type of management technique used is known as, very straightforward, option C, that is work sampling. क्या कर रहे हो? You are just doing an observation and recording beta of a particular professional and their work, what they are doing. एक प्रोफेशन उठाओ, उनका काम को ऑब्जर्व करो, उनके एक्टिविटीज को रिकॉर्ड करो एंड फिर देखो कितनी एफिशिएंसी है. ठीक है, दैट प्रोसेस इज नोन एज वर्क सैम्पलिंग बेटा. ठीक है, नेटवर्क एनालिसिस जो होता है, रिसेंट क्वेश्चन था ये. नेटवर्क एनालिसिस में दो चीजें होती है. वन इज पर्ट. व्हाट इज पर्ट? program evaluation and review technique beta. One is PERT, that is program evaluation and review technique, and second is CPM, that is critical path method beta. Second is going to be critical path method. That is important. These are two parts of the network analysis. Matlab, if you have launched a healthcare program, you are continuously going to evaluate beta and review the results of that healthcare program continuously. This is basically called as program evaluation and review technique beta. Q, क्योंकि once you analyze the results continuously of a healthcare program, you will be able to understand what improvement should have been done, what improvement should be done beta. That is important. Second is critical path method. Matlab, for example, you are having 10 alternatives better to launch a particular healthcare program. One alternative is three alternatives, for example. One alternative is taking 10 years, another alternative is taking 5 years, and third alternative is taking 8 years. Now, which alternative are you going to choose? The first alternative I'll choose better, that is of 10 years. That is called as critical path method. Matlab, longest path basically beta for healthcare program is known as critical path method. Clear? The longest path is basically known as the critical path method beta. Clear? Next important is system analysis. What is system analysis? Bolo. Comparison of two cost effective alternatives. इसका मतलब, for example, if you are a health officer beta and you have to launch a healthcare program now, तो तुमने अपने assistants को बोल दिया, you have asked your assistants beta that give me options. So your assistants have given you 2 or 3 options beta. Now what are you going to do? You are going to compare all these 2 or 3 options beta, but based on their cost efficiency. मतलब, for example, the first program is taking 800 crores, second program is taking 500 crores, the third program is taking 300 crores. So obviously you're going to compare beta each and every alternative, not only based on the price or the money it is not going to need, but also कि how much efficacious the program is going to be beta. ऐसा कर दिया हमने, for example 300 करोड़ का प्रोग्राम लॉन्च कर दिया, बट कोई उसका असर ही नहीं हुआ, तो कोई मतलब नहीं बनता ना. तो सिस्टम एनालिसिस का मतलब है टेकिंग और कंपेयरिंग ईच एंड एवरी कॉस्ट इफेक्टिव ऑल्टरनेटिव बेटा, कि उसकी प्राइस कितनी है, खर्चा कितना आएगा, इफेक्ट्स कैसे होंगे, रिजल्ट्स कैसे मिलेंगे, ये सब कंपेयर करने के बाद बेस्ट ऑप्शन ऑप्शन को चूज करना इज कॉल्ड अ सिस्टम एनालिसिस. होपफुली अंडरस्टूड, क्लियर. कॉस्ट बेनिफिट एनालिसिस मतलब द प्रोग्राम हैज बीन लॉन्च्ड ऑलरेडी बेटा, यहाँ पे अभी लॉन्च नहीं करना, लॉन्च हो चुका है ऑलरेडी. द प्रोग्राम हैज बीन लॉन्च्ड, इट हैज बीन कंप्लीटेड. नाउ you have to evaluate the output of that healthcare program. You have to do an evaluation of the output of that healthcare program. Now you will do that evaluation in terms of the, sorry, results achieved or the money saved. क्या करोगे? In terms of monetary benefits बेटा, ठीक है, in terms of monetary gains or monetary benefits. तो cost benefit analysis का मतलब होता है basically that once I have launched this healthcare program, due to this healthcare program, how much money I was able to save. मतलब अगर तुम टीबी का प्रोग्राम लॉन्च नहीं करते तो टीबी के डायग्नोसिस में, इलाज में तुम्हारे 500 करोड़ खर्च होने वाले थे, बट प्रोग्राम लॉन्च करने की वजह से अभी ऑलमोस्ट 400 करोड़ बच गए तुम्हारे. तो अगर तुम उस रिजल्ट को, मनी पैसा कितना बचा उस मामले में एनालाइज कर रहे हो बेटा, दैट इज कॉल्ड एज कॉस्ट बेनिफिट एनालिसिस. कॉस्ट इफेक्टिवनेस एनालिसिस क्या होगा देन? कॉस्ट इफेक्टिवनेस एनालिसिस का मतलब होता है आफ्टर द हेल्थ program has been completed, I am going to evaluate the output of the healthcare program, not in terms of money, not in terms of monetary gains, but in terms of results achieved, that is the number of lives saved beta. ठीक है. तो अगर हेल्थ केयर प्रोग्राम खत्म होने के बाद आई वुड से दैट अगर प्रोग्राम नहीं होता तो ऑलमोस्ट वी वुड हैव लॉस्ट फॉर एग्जांपल 50,000 पेशेंट्स, बट एज द प्रोग्राम वाज लॉन्च्ड वी हैव ओनली लॉस्ट डेफिनेटली 10,000 पेशेंट. सो दोस 40,000 पेशेंट्स व्हिच वर सेव्ड बेटा, दैट if you are trying to assess, that is called as cost effectiveness analysis. तो कितनी जान बचा पाए अगर उसमें कैलकुलेट कर रहे हो तो कॉस्ट इफेक्टिवनेस एनालिसिस कहलाएगा. कितने पैसे तुमने बचा लिए उसमें कॉस्ट बेनिफिट एनालिसिस कहलाएगा. होपफुली क्लियर है अभी. क्वेश्चन नंबर 147 बेटा, लीस्ट आयरन कंटेंट इज गोइंग टू बी प्रेजेंट बेटा इन विच अमॉन्ग द फॉलोइंग फूड सब्सटेंसेस. बोलो. हमें पता है मिल्क इज गोइंग टू हैव द लीस्ट अमाउंट ऑफ आयरन कंटेंट, मोस्ट अमाउंट ऑफ calcium content, maximum calcium and least amount of iron content is going to be present in milk beta. French beans, pumpkin seeds, pista, they have definitely a lot of iron. Rather, maximum iron content is going to be present in dried pumpkin seeds beta. Other foods can be spinach, jaggery, okay? These can be other food substances where a lot of iron is going to be present. Iron absorption is going to increase by, iron absorption increases when we give vitamin C, that is nimbu pani de do. Second, it also increases in which kind of medium? Acidic medium. Okay? But if they ask you that iron absorption decreases in which condition? Iron absorption decreases if you give tannets beta, that is tea and coffee basically. Tea, coffee will decrease the iron absorption. Second, phytates also, that is milk. Even milk can decrease the iron absorption beta, that is important to be remembered. ठीक है, तो tannets and phytates both are known to decrease the iron absorption beta. Clear? चलो. Question number 148 basically. क्या हुआ? Potatoes won't cause much of a effect basically beta. Question number 148 if I talk about, in ORS basically glucose is added as it enhances salt absorption. Same question, because both of them get absorbed beta via the intestinal lumen with the help of Which mode of transport? Answer. So it will get usually absorbed with the help of option D, that is active transport beta. Which active? Secondary active transport beta. It can be a type of co-transport or a symport also, but the beta answer will be a secondary active transport. It is a type of co-transport or a symport beta. That is important to be remembered. No issues with this, anybody? Facilitated diffusion will be glut beta. And osmosis is not for solute, osmosis is for solvent, that is fluid beta. फ्लूइड के लिए ऑस्मोसिस होता है, सोल्यूट सॉलिड्स के लिए डिफ्यूजन होता है. क्लियर है बात? Question number 149. A child has been brought to you, beta, with complaints of generalized weakness and pallor, sarkari symptoms of anemia. On inspection, he appears ecteric, that is jaundice B है. Per abdominal examination reveals there is enlarged liver and spleen, that is hepatosplenomegaly is going to be there, beta, in the patient. History of infection has been given in the patient, beta. Okay, the history of infection has been given in the patient by the parents and a peripheral smear has been given. What is the likely finding observed over here? What is the diagnosis? ये बताओ पहले. Mm-hmm. Co-transport is basically, beta, if both the substances are either getting transported in the same direction or they are getting transported in the opposite direction. Both of them are called as co-transport. Now, if both of them are getting transported in the same direction, that is called as symport. If both of them are getting transported in opposite direction, that is called as antiport or counter transport basically. So both of these are examples of co-transport. So co-transport बहुत broad term हो जाती है, इसीलिए we cannot answer that. अब मुझे बताओ, अनीमिया के सिम्टम्स है जनरलाइज्ड वीकनेस एंड पैलर, उसके साथ साथ एक्ट्रस है, एनलार्ज लिवर एंड स्प्लीन है, तो डेफिनेटली इट इज अ केस ऑफ विच काइंड ऑफ अनीमिया? हिमोलिटिक अनीमिया. आई होप ऑल ऑफ यू आर क्वाइट अवेयर ना कि जब भी अनीमिया के साथ साथ हेपेटोस्प्लीनोमेगली एंड जॉन्डिस होता है, it is a classical case of hemolytic anemia. Which hemolytic anemia it is? It is the G6PD deficiency anemia, and G6PD is going to be the most common enzyme deficiency in humans, beta. Why G6PD बोल रहे हैं हम? Here you are able to see, beta, the peripheral blood smear is usually showing you a very classical appearance called as the option C, that is Heinz bodies, beta. These are the Heinz bodies which are going to be seen over here. Apart from that, peripheral blood smear may also show you with cells. The bite cells, beta. The bite cells will also be definitely seen in patients of G6PD deficiency anemia. That is important. हमें पता है in G6PD deficiency anemia, after an episode of infection or after certain drugs, beta, which kind of drugs? Usually either fava beans or drugs like anti-malarials, beta, all your queens or sulfonamides. Very good. So these kind of drugs, if you take, beta, the patient symptoms are going to improve or worsen. Worsen. The patient symptoms are going to worsen, beta. That is a classical feature that you have to keep in mind. Clear? Yeah, Rakna. Acanthocytes are seen in. Sorry. Very good. Acanthocytes are basically seen in patients suffering from A beta lipoproteinemia, beta. We have discussed MTP gene mutation in biochemistry. So in that condition, beta, there is decreased production of the lipoproteins, and that condition is known as A beta lipoproteinemia, where acanthocytes are going to be seen. Howell Jolly bodies are seen in post-splenectomy. Cabot rings and Howell Jolly bodies are a feature of post-splenectomy patient, that is after removal of the spleen, beta. Pelger U cells are nothing else but hyposegmented neutrophil. Normally, we know better that neutrophils are going to have 3 to 5 lobe nucleus, but in this condition, there will be only a 2 lobe nucleus. These are called as hyposegmented neutrophils, known as Pelger cells, seen in multiple conditions, especially myelodysplastic syndrome or myelofibrosis. Beta. Conditions usually myelodysplastic syndromes में दिखता ही है Pelger cells. Hopefully clear. Treatment in cases of G6PD deficiency anemia: avoid triggers. That's it. ठीक है? Only treatment for G6PD deficiency anemia is avoid all these triggers, beta. The patient will not develop any problem. Question number 150, last for today. A 12-year-old girl, beta, has developed ITP, that is immune or idiopathic thrombocytopenic purpura, which was diagnosed after she has suffered definitely, beta, for symptoms for a span of 2 weeks and has been managed with steroids beta. There is a recurrence basically of low platelet count once steroids were stopped beta. On current examination, there is no petechiae as such beta, or there is no physical evidence of bleeding also. What is the next line of management in this case? If I talk about the two types of ITP, one is going to be acute ITP, second is going to be a chronic ITP. Acute ITP is usually seen in children between 2 to 6 years of age. Chronic ITP is seen in adults between 20 to 40 years of age. We know that acute ITP can be seen in both males and females equally, but chronic ITP is more common in females. Next, history of antecedent infection 1 to 3 weeks earlier will be given in acute ITP. मतलब acute ITP में बच्चे में 2 से 3 हफ्ते पहले कोई ना कोई इन्फेक्शन रहा होगा, स्पेशली वायरल इन्फेक्शन. बट क्रॉनिक आईटीपी में द हिस्ट्री ऑफ इन्फेक्शन इज वेरी अनयूजुअल और अनकॉमन. Next, onset of bleeding which is there, it is very sudden and abrupt in acute ITP, gradual or slow in cases of chronic ITP. Platelet count is going to be very, very low in acute ITP, less than even 20,000, whereas in chronic ITP, it will be 30,000 to 80,000 cells. We know that as infections were sorry, as infections were common in acute ITP beta, the problems like eosinophilia or lymphocytosis will be seen in acute ITP. As chronic ITP में there were no infections, so eosinophilia or lymphocytosis will not be seen. Duration, हमें पता है acute ITP is going to last for a shorter duration, that is usually less than 2 to 6 weeks beta. Okay, but chronic ITP lasts for a span of months to years, almost more than 6 months. ठीक है. Spontaneous remission occurs in majority cases of acute ITP. Most cases of acute ITP beta 80% cases will always show a self spontaneous resolution. अपने आप ठीक हो जाते. No treatment is required, only reassure sorry, only reassurance is given. इसमें पेशेंट को फालतू में ट्रीट किया गया था बेटा. नो ट्रीटमेंट वाज एक्चुअली रिक्वायर्ड इन द चाइल्ड. But in cases of chronic ITP, the spontaneous resolution is very uncommon. Therefore, here we always need a treatment, and that treatment will be initially steroids. If not managed, then IV, IGs beta. So अब मुझे बताओ definitely if they ask you that what should be done in this condition, it is a chronic or acute ITP? Small child, definitely symptoms for 2 weeks beta. ठीक है. And therefore definitely if they ask you what should be the treatment has to be option C, wait and watch. अपने आप ठीक हो जाएगी. Just have patience, that is what is important. Clear है बात? चलो, टाटा, bye bye, good night. Next I'll inform you the date and time.